Thanks a lot. Okay, so yoga research. I'd like to talk about that. The state of yoga research, where it is today, and where it's headed. The best way to understand how yoga research meets the healthcare system is to try to understand how people die. Okay, it's pretty morbid, but here we go. Heart disease, heart disease and cancer by far, number one and number two. Okay. There's a fair amount of research on cardiovascular health with yoga. We've all heard, it's almost common knowledge now that people expect that you can improve your heart conditions through practice of yoga. So it's very well known. That's great. Cancer, there's probably more studies on mindfulness and meditation and maybe some hatha yoga on cancer patients and cancer survivors. So also, we're doing a good job in that area. If you look at some of these other ailments, chronic respiratory diseases, stroke, Alzheimer's disease, diabetes, there's budding research out there now that's showing how yoga can actually improve some of those health conditions and help prevent some of those conditions. Looking right here, number 4, accidents. So accidents were 4th leading cause of death in the United States in 2015. Out of those accidents, unintentional poisoning represented 1/3, or greater than 1/3. And what is unintentional poisoning? Right? Let's see. Notice greater than motor vehicle accidents. Okay. Fast forward a little bit to 2016, the CDC, their statistics, 64,000 drug overdose deaths. 2/3 of those with opioids or opioid-related drugs, heroin, opioid synthetic drugs. That's 5 times more than 1999. So you've heard Dr. Claiborne talk about this as probably the largest epidemic that we've seen lately, and it's going to get worse. 115 Americans on average die every single day from an opioid use overdose. In 2016, pulling out opioid overdoses, that's going to crack the top 10 now in leading causes of death. Forget about lumping it together with what do you call it? Accidents. Okay? And there's no end in sight. It's going to continue to climb. Right? So that's more than motor vehicle accidents. It's getting close to diabetes. It's giving diabetes a run for its money very quickly. So let's look at some better facts. Let's look at yoga research. If you search PubMed and you look for the word yoga in the title of the article, you will see an explosive growth of yoga research over the last 5 to 7 years. Sadly, clinical trials are what really make the difference when it comes to impacting healthcare policy. It's fairly small, okay? Less than 100 publications with the use of the word yoga in the title. Okay. Mindfulness, there's quite a bit. Okay. If we look at the last 5 years, from 2013 to 2017, and we look and search PubMed as well, we will have found 259 publications work off of clinical trial studies with also the word yoga in its title. 33 of them contain the word cancer. So that's good. 28 of them had the words anxiety, depression, or PTSD. Now you've heard from Dr. Claiborne too, the comorbidity, right, the dual diagnosis. More than 50% of people with mental health disorder also have a substance use disorder or are more prone to develop a substance use disorder. So we can say that we're doing a reasonably good job at looking at the benefits of yoga with mental illness. 12 of those studies or articles I should say, they're not singular studies. These are publications that come from maybe 1 or 2 studies. They addressed hypertension and diabetes. These are silent killers. These are things that take a long time for you to die. Okay? But there's a lot of budding research now that shows how yoga and a daily yoga practice, a regular yoga practice, can attenuate these symptoms, these risk factors. 14 of these studies also mentioned back pain. So how many people know somebody with back pain? Right? So how would it be different if your doctor prescribed to you back bends instead of painkillers? Right? How much healthier this world would be. But it's also much more difficult to go to the back bend, right? None of these studies reference the word addiction, misuse, which is the word that they like to use in the research world, or opioid. So none of those terms were used. So that tells us something, that we're missing something here in the study of yoga and mindfulness with respect to recovery and addiction. Let's compare. So yoga, we have 259 publications. Trials with the word opioid, we had 481 publications, almost twice as many. Okay? Yet, only 35 of those dealt with addiction or misuse. So where are the other studies? What are they looking at? The medical treatments for addictions, as you've heard before. There's promise, though, even though none of them contain the word yoga. There is promise. 9 of the publications contain both opioid and mindfulness. We know that mindfulness, meditation, and yoga practice, those 3 things will help. They're not the cure, but they will help. Okay? So we're starting to see people interested. We're starting to see the scientific community looking to incorporate yoga and mindfulness. So these kinds of studies are important, and this is why we host a research conference every year. This is our 3rd annual yoga research conference. It'll be right here in Austin, Texas, October 27th and 28th, right at UT on campus. And it's 2 days. It'll be more information like you've heard from Dr. Claiborne times 20. We'll have speakers, 20 plus speakers and poster presenters, everything, hot yoga, normal temperature yoga, any kind of yoga, it's all good yoga, right? And all of these things will have different applications. We talk about slow breathing. One of the leaders in studying yoga and breathing, he just calls it slow breathing. He won't call it pranayama. We'll show all of these benefits which relate to your Sudarshan Kriya, right? All wonderful things that you will learn. Cancer, Alzheimer's disease, autism. You're going to start to hear and see the latest research, pilot research that should stimulate some thoughts. Right? So we wouldn't be here today without Jeannie Heaton, who unfortunately couldn't attend. Jeannie Heaton, over a decade, has been sober and clean from a heroin addiction. She became a yoga teacher. She has started this whole program called One Posture at a Time, where she brought yoga to methadone, the methadone to abstinence clinic, where she was holed up for 18 months. She went there, she tried, it didn't work. So what she found was that the best thing that she could do is just spread the word, teach yoga to anybody and everybody who is in recovery. She goes out to recovery centers. She does donation classes in Athens, Georgia. So we have to thank her, even though she's not here. Okay? So yoga recovery, yoga is medicine. That's our vision. You can still sign up for our yoga research conference. You can also, if we take money too, green money is good, donations that support our recovery centers, that support our work in the recovery centers. That's our pledge, that anything that you do today will support them. Okay. So I invite you all to stay and suffer for the next 90-minute class, because suffering is good, short term. All right. Thank you very much for all coming here, and thank you to the sponsors. And we can take a few questions if you would like for maybe 5 minutes, but then we'll also, 5 or 10 minutes maximum, but we'll also get ready for the class across the hall if you're going to stay. Okay? Thank you all.